Good day to all of you. For this discussion, for this lesson, I am going to discuss Chapter 2, Concepts of Nursing. And under this, we have two subtopics, nursing as a profession and then nursing as an art. Let us get to know first nursing as a profession. So how do we define profession? It is an occupation that requires extensive education, or a calling that requires special knowledge, skill, and preparation. Please take note of the two terms used in this definition. It is an occupation and it is a calling. And this is very true, right? Because as a student nurse, as a bachelor's degree in nursing, as our course, yun yung course natin, we are being prepared for 4 years to acquire that necessary knowledge, skills, and attitudes so that when we become registered nurses in the future, we are well prepared. We are ready to face the different challenges na ano man yung kaharapin natin, we can overcome and we can perform our roles and functions as a nurse. Now, what are the different criteria of a profession? Ano ba yung mga criteria para masabi natin na nursing is really a profession? First, requirement of prolonged specialized training to acquire a body of knowledge pertinent to the role to be performed. So, di ba, tayo ay 4 years ka nag-aaral, tayo ay nag-training, nagkakaroon ng related learning experience para ma-acquire that yung knowledge na gusto nating makuha to become a well-equipped and skillful registered nurse. Second, an orientation of the individual towards service. So definitely nursing is oriented to care for the sick or to care to promote health, to prevent disease, and to rehabilitate. Okay, so definitely we have the different scopes of nursing kung tawagin, di ba? So that is to promote health, to diagnose and treat, to rehabilitate, and to provide palliative care if necessary. So, yun, we are oriented to serve people. A code of ethics, that is behavior that is oriented towards good or bad. And that is very true, di ba? We have, in our college years as a nurse, di ba, you have your subject na bioethics or ethics kung tawagin to really get to know ano ba yung mga dapat nating malaman or behavior na i-perform to know if it is morally good or bad. And then number four, autonomy. So this our profession, which is nursing, is autonomous, or meaning independent tayo. We can perform our nursing roles, our nursing functions independently. Although we are not working in isolation, we are not isolated in the hospital or in any setting. We are always in collaboration to other healthcare professionals. So self-govern yung ating field, yung ating profession. Okay, so a professional organization, and since yun na nga, um, we are like a self-governing profession, definitely dapat may nagko-control, merong nag-oversee ng ating profession, and that is a professional organization. In our case, our professional organization is the Philippine Nurses Association, or PNA. So that is our mother association here. And then marami pang tayong organizations depending sa anong field yung nursing na gusto nyong pasukin. So merong mga available na organization dyan. Like for example, kung ikaw ay OR nurse, pwede kang magpa-member sa Operating Room Nursing Association of the Philippines and many other specialties pa. And then when we say professionalism, it refers to professional character, spirit, or methods. So it is a set of attributes, a way of life that implies responsibility and commitment. So yung professionalism, ito yung pinapakita natin sa ibang tao na we are acting, na talagang we are professional. Okay? So, while when we say professionalization, ito naman yung process of becoming professional. That is of acquiring characteristics considered to be professional. So, professionalization, ito yung process para ikaw ay maging isang professional. Okay? So, professionalism, ito yung character na pinapakita natin sa ibang tao. So, we are done with the criteria and then the different definitions. Now, what are the different personal qualifications of a nurse? Ano ba yung dapat na personal na katangian mo para ikaw ay maging isang nurse? First, we are going to dapat you have your own philosophy of life. So every person must develop a personal philosophy of life and plan for expanding his personal life. So ibig sabihin, meron kang sariling filosofiya na sinusunod sa iyong buhay. Meron kang pamantayan na sinusunod sa iyong pamumuhay. And when you become a nurse someday, so definitely, you have your own philosophy na mabubuo to guide you in your own nursing actions. Next, good personality. So it consists of the individual qualities that differentiate one person from the other. So, dapat definitely yung personality natin is in general good. Now, ano yung components ng good personality? So, we have here several components. First, personal appearance. So, dapat yung ating, for example, yung posture mo, yung iyong grooming. Yung posture is how you carry yourself or how you, for example, yung ano, um, how you handle yourself physically. Okay? And then grooming, kung yung neatness sa iyong katawan. And then dress and uniform, which is the nurse uniform and the cap for the female. So, ito yung, di ba, check sa atin or may experience ito kapag nag-duty kayo. So, every time na kayo ay mag-duty, check yan ng clinical instructor if you are properly groomed, you are wearing your complete uniform. So, we wear the uniform with respect and dignity. So, that is for the personal appearance. Dapat, physically, we look uh, properly. Next, character. So, the nurse is basically a good person. So, yun na nga, dapat, in general, we are good in terms of our character, in terms of our personality. Attitude, the manner of acting, thinking, or feeling that is indicated by one's response toward another person, situation, or experience. So for the attitude, meron tayong tinatawag na 8 beatitudes of a nurse. So ano ba yung mga attitudes na walo na to? So first, you have acceptance. Second, you have helpfulness, friendliness. You are firmness, permissiveness, limit setting, sincerity, and competence. So i-check nyo guys yung sarili nyo if you possess this different attitudes for you to be able to say na talagang good ba yung inyong personality because this is a component to 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 be considered na you have a good personality. And then charm. So when you say charm, to influence the senses or the mind by some quality or attraction. So ask yourself, are you charming? Now, to acquire charm, one is to cultivate the following. So para kayo ay maging charming, ito yung mga dapat nating ma-cultivate or ma-possess sa ating mga sarili. So, first, you have your voice. Next, you have your manner. Second, third, you have your heart, intelligence, and then poise. Yung poise, it includes calmness and composure, and that includes face reality and avoid emotional flare-ups. And then you know how to control your temper. So think before acting and avoid verbal and physical aggressiveness. So dapat pag sinabing poise, even though na ikaw ay under pressure, even though na ikaw ay napaka-toxic ng iyong situation, still, you know how to manage yourself. You are still calm, you are still composed. So, that is under poise. And yun yung mga different things that you have to cultivate for you to become a charming person. Yung voice, heart, manner, intelligence, and poise. So ito ay skill na dapat nating matutunan. Okay? Next, um, qualities and abilities of a professional nurse naman tayo. So number one, the first quality and or ability of a professional nurse has faith in the fundamental values that underlie the democratic way of life. So you have respect for human dignity. So definitely you should be respectful to every human that you encounter. Self-sacrifice for the common good. Strong sense of responsibility for sharing in the solution of the problems of the society. So tayo ba ay nakaka-contribute sa solusyon para sa ating mga problema or baka tayo naman ay nakakadagdag lang ng problema at hindi tayo nakakatulong sa pagsosolve ng mga problema na to. Instead na dapat solusyon yung may ambag natin. So i-check nyo guys ano, if you possess this different traits or qualities and abilities. Second, has a sense of responsibility for undertaking those with whom he works or associates with through the use of skills, life working effectively through therapeutic relationship. So, are you responsible for understanding yung works ng ibang tao? And then, are you able to work with them effectively and be able to establish a therapeutic relationship? So mamaya we have a separate discussion kung ano ba yung therapeutic relationship na tinatawag in the in nursing profession. So we will go deeper on therapeutic relationship later. So third, has a basic knowledge, skills, and attitudes necessary to address present-day social problems, realistic and well-organized thoughts through the use of critical thinking. So ito yung isa sa pinakamahalagang skill na ma-possess nyo as a nurse. You should be a critical thinker. Okay, so dapat tayo ay malalim mag-isip, tayo ay nag-iisip beyond uh, what we can sense. Okay? Dapat napaprocess natin yung mga bagay-bagay and we are considering different we are considerate of all the things or all the aspects na nasa paligid natin. Okay, before we act. So we should think critically. And then number four, has skills in using written and spoken language, both to develop own thoughts and to communicate them to others. So dapat, hindi ka lang magaling magsalita, you can also write effectively. And then otherwise, hindi ka lang dapat magaling magsulat, dapat you can speak also effectively. Number five, appreciates and understands importance of good health. So definitely as a nurse, tayo ay nagpro-promote ng health. So as an individual, dapat you also possess good health. Has emotional balance. So definitely yung ating emotional aspect should be stable or should be adaptable to the condition na meron tayo. Accepts and tries to understand people of all sorts regardless of race, religion, and color. So hindi tayo bias, hindi tayo judgmental sa mga tao na kakasalamuha natin. And we accept them as they are. Okay, next, number 8, likes hard work and possess a capacity for it. 9, appreciate high standard of workmanship. So we can work with other people and we can work effectively as an individual. And then number 10, knows nursing so thoroughly that every client will receive excellent care. So yun yung gusto nating mabigay sa ating mga pasyente. Excellent service, excellent care. Now, we have here Benner's stages of nursing expertise. So we are now jumping to another like things na dapat malaman ninyo in the nursing profession. And we have here si Dr. Patricia Benner. She is very popular when it comes to the stages of nursing expertise. So, si Dr. Patricia Benner is a nursing theorist who first developed a model for the stages of clinical competence. So, her book um, is entitled From Novice to Expert, Excellence and Power in Clinical Nursing Practice. So, ito yung kanyang popular work. So, from novice to expert, meaning yung different stages of a nurse, yung kanyang pinagdadaanan, from novice, meaning as a beginner, or yeah, from as a beginner up to siya ay maging expert. Okay, so her model is one of the most useful frameworks for assessing nurses' needs at different stages of professional growth. So dito makikita natin ano ba yung transition ng isang nurse from a beginner or from a novice nurse to an expert. So let's discuss the stage one by one. The first stage is novice. Okay, stage one is novice. Dito, yung isang nurse has no experience. For example, nursing student, and you can consider yourself as a novice nurse, meaning you do not have an experience. So performance is limited, inflexible, and governed by context-free rules and regulations rather than experience. So, ayun, medyo stiff pa kayo, di ba? Since you are just a student and you are not yet exposed to different situations or conditions. So definitely limited pa lang yung nagagawa nyo. So that is stage 1, novice. Stage 2 is advanced beginner. So demonstrates marginally acceptable performance. Again, marginally acceptable performance. So recognizes the meaningful aspects of a real situation. So for an advanced beginner has experienced enough real situations to make judgments about them. So unti-unting nade-develop na yung iyong gawain when it comes to nursing as an advanced beginner. And then stage 3, competent. So for competent, it has 2 to 3 years of experience. So you as a nurse demonstrates organizational and planning abilities, differentiates important factors from less important aspects of care, coordinates multiple complex care demands. So dito you are functioning na within your organization, and then nakakagawa ka na ng complex care to your patients, and even multiple functions nagagawa mo na siya. Kasi nga, you're competent enough as a registered nurse. So, 2 to 3 years na yung experience mo dito. Kaya talagang somehow rich na yung iyong knowledge and skills in terms of your environment. Stage 4, proficient, has 3 to 5 years experience, perceives situations as whole rather than in terms of parts, as in stage 2. For proficient, you use maxims as guides for what to consider in a situation. Has holistic understanding of the client, which improves decision making and focuses on long-term goals. So as a proficient nurse, you are looking now, you're parang future-oriented, or yung planning mo na mas doon ka na sa long term na yung mga objectives. And then you can see the client or our patient holistically, and you are guided by your maxims or yung mga principles that you have in life when you are under this stage. So again, for proficient, 3 to 5 years ang experience dito. And then stage 5, expert. So this is the last stage of Benner's stages of nursing expertise. So when you say ikaw ay expert na, your performance is fluid, flexible, and highly proficient na. So you no longer requires rules, guidelines, or maxims to connect an understanding of the situation to appropriate action. So you demonstrates highly skilled, intuitive, and analytic ability in your situations, and is inclined to take a certain action because it felt right. So in this stage for expert, You are no longer guided or hindi ka na lang nakakahon sa rules, sa guidelines or maxims na pinatutupad in the organization. So it's like you are flexible and ginagawa mo yung isang bagay ng very fluid lang, very spontaneous, and because rich na yung experience mo, you already you really do know what to do. Alam mo na yung gagawin mo because you have experienced everything in terms of this profession. So, as a nurse, spontaneous yung actions mo. Okay? So, very, very quick ang iyong um, yung actions and then yung iyong thinking. So, that is for stage 5. Okay? That is for the expert. So, that is ano. So, these are the different stages according to Benner. Okay, stages of nursing expertise from novice to expert. So we all begin as a novice nurse, and as we go along sa ating profession, as we go along sa pagiging nurse natin, tayo ay nahuhon, tayo ay still na-develop hanggang sa ma-attain natin yung specific stage until tayo ay maging expert in our field. Next, what are the different fields of nursing naman? So let's get to know kung saan-saan kayo pwedeng mapunta na fields sa nursing. So letter A, you have nursing in primary care setting. So pag sinabing primary care setting, primary, this is the initial health care for general complaints. So ito yung yung kumbaga unang puntahan ng tao. Okay, kapag sila ay may problema sa katawan. Usually the person's first contact with the healthcare delivery system. So ito yung yun na nga unang napupuntahan ng tao para magpatingin sa kanilang nararamdaman. Managing current healthcare needs and preventing further problems. And then we have here different nursing field under the primary care setting. So you have public or community health nursing. Uh, if you would like to work sa mga community, sa inyong barangay, sa inyong munisipyo, or in the public, so this is the field. Next, occupational nursing or industrial nursing. Ayan sa mga specific work sa mga specific industry na kung gusto mo maging, for example, clinic nurse. So, I mean, kasi we have a clinic nursing din. So, clinic nursing, ito yung mga designated sa mga clinic. Okay, for occupational nursing, I am referring here sa pinagtatrabahuhan, for example, mga engineer, mga you are in the specific profession. So, bawat field na yon, meron silang definitely nurse or occupational health nurse kung tawagin. Okay? So, pwede rin kayo mapunta doon. So, yun na nga, clinic nursing sa mga clinics, for example. School nursing, so pwede rin kayo mapunta sa mga eskwelahan if you would want to become a school nurse. Private duty nursing, ito yung mga nag-duty privately. Okay? Military nursing, just like in this picture. Ambulatory care nursing. Nursing in correctional facilities. So, yun yung for nursing in primary care setting. Meaning, ito yung unang takbuhan ng mga patient or ng mga client natin na seeking for help in terms of their health. Okay, so letter B, nursing in secondary care setting. So if kanina primary, this one is secondary. So institutional nursing, ito na yung ating hospital nursing. Ito na yung mga nursing working in the hospital. So again, secondary care setting yon. So in here, you can become, for example, director of nursing, clinical coordinator, head nurse, staff nurse. So as a staff nurse, marami tayong areas in the hospital. You have OB-GYN nursing, you have pediatric nursing, you have orthopedic, ito for sa mga bones to, musculoskeletal, OR nursing, operating room nurse to, medical surgical nursing, psychiatric nursing, emergency room nursing, critical care nursing. So yun yung mga different areas or specialization in the hospital. Flight nurse, that is also part of secondary care setting, and infection surveillance nurse. So that is also um, under hospital nursing or secondary care setting. So next, the third type, or I mean the third major fields of nursing, that is nursing in tertiary care setting naman. So again, yung kanina, you have primary care setting. Second, you have secondary care setting. Ito naman yung tertiary care setting. So in this case, ito yung skilled care setting natin, rehabilitation setting, kasama rin dito, and yung mga advanced practice nursing. Ito guys, sa common to sa abroad, for example, in the United States. So, meron silang mga advanced practice nursing. Very ano to, yung kanilang education is very advanced, and then yung training and yung certification nila really is extensive. So, ito yung um, mga specialties under APN. You have clinic nurse specialist, nurse anesthetist, nurse educator, nurse admin, and nurse researcher. Ang common, ito, clinical nurse specialist, nurse anesthetist. Okay, meron pang ano, clinical nursing practitioner. So, extensive, that, para mag-aaral ka pa ulit for several years para ma-obtain mo yung advanced practice nurse or advanced practice role na yan as a nurse. Okay, next, we now proceed to the types of nursing interventions. So, itong types of nursing intervention, na-discuss to in your madi-discuss natin ito sa paggawa ng NCP. Now, we have three types of nursing interventions. You have independent or nurse-initiated interventions. So, ito yung mga um, here, we can solve the client's problems without consultation and collaboration with physicians or other healthcare professionals. Ibig sabihin, we can address the problem of the patient on our own. We can perform, we can function independently. Ano yung example nun? Giving health teachings on effect of smoking and alcohol abuse. So commonly, health education. Ito yung pwede nating magawa. And then monitoring to our patient. Checking of, for example, vital signs. We can do that independently. And as we go along with our topic, malalaman nyo pa ano ba yung mga nursing interventions pa na pwede natin magawa independently. Okay, either in the hospital man yan or in the community setting. Second, dependent or physician-initiated intervention. So in this case, the nurse intervenes by carrying out physician's written order but requires nursing judgment or decision-making. So dito, we follow kung ano ba yung order ni doctor sa ating pasyente. Meaning we are relying on the doctor's order. So kung ano yung order niya, we give the order after evaluating if definitely kung within the uh, rational or within kung tama ba yung order ni doctor. So we always check on that. Okay? So as a nurse parang we like we check first kung akma ba yung doctor's order so that kung merong hindi tama, we can notify the physician first before carrying out the order. So parang tayo ay taga-check somehow before we carry the doctor's order. So ganun dapat hindi lang tayo carry out ng doctor's order. We should first think, syempre based on our clinical judgment, based on our knowledge, malalaman natin yon kung okay ba yung doctor's order. And through experience din. Okay? For example, ang example dito is administering antibiotics to the client. So that is a dependent or physician-initiated intervention. So, hindi tayo makakagalaw without a doctor's order. So, meron yon. For example, yun nga, kadalasan yung mga giving medications to our client. For example, intravenously, yung pagpa-perform ng several procedures. Okay? So, mas malalaman pa natin yon as we unfold our lessons here in Funda. Number three, interdependent or collaborative intervention. So these are therapies that require the knowledge, skill, and expertise of multiple healthcare professionals. Example, ng interdependent, ibig sabihin to, no, collaborative. We are working with other healthcare professionals, not just sa isang doctor, but also in other um, fields or in other healthcare professionals nga. For example, sa physical therapies, sa laboratory technician, sa radiologist. Ayun, ibig sabihin, we are coordinating the care of our patients sa iba't ibang professionals in the hospital. So that is collaborative intervention. So that is like nursing as a profession. Okay, so in continuation, we are going to discuss now the history of nursing. So saan ba nagmula? Bakit ba ngayon nursing is a profession na? Before, ano ba yung tingin natin sa nursing? Saan ba siya nag-root? Saan ba siya nagsimula? So we are now going to discuss the history of nursing. So first, we have the intuitive period. So intuitive, included dito yung ating prehistoric early Christian era. So in this case, more on intuition lang yung ating pag-aalaga. Meaning, base lang sa kung ano yung alam nila during that time. And then nomads pa yung mga tao during this time. They travel from one place to another. Survival of the fittest. Kumbaga yung kanilang um, pang-araw-araw na buhay. Kailangan nila makasurvive. And then sickness is due to voodoo. So just like in this example, di ba, we are familiar with voodoo doll. O yan, na-associate nila yung sickness or yung pagkakasakit sa voodoo or like parang incantation or magic. So, perform out of feeling of compassion for others. So yung pag-care or yung pag-nursing is ginagawa out of compassion, okay, sa ibang tao. It is performed out of desire to help, sa kagustuhang makatulong. So, they care or yeah, they care sa ibang tao. Performed out of wish to do good. And then nursing is given by women. Okay, by the women. During this time, babae lang yung, or commonly, sila babae lang yung nagbibigay ng nursing or ng care sa mga may sakit. So, women plays subservient or dependent role. So, pag sinabing subservient, submissive sila sa, for example, sa nagbibigay sa kanila ng order during this time. Okay? So, again, hindi pa definitely formal ang nursing during this time. Very low pa yung tingin natin sa nursing during this time. Kasi nga, nagsisimula pa lang. Hindi pa nursing yung tawag natin during this time. Okay? So, this is the prehistoric under intuitive. So, uh, to continue, so prehistoric, early Christian era, shaman. So when we say shaman, so ito siya, this is a picture. So uses white magic to counteract the black magic. So naniniwala sila sa mga magic na yan, either white magic or black magic. So shaman, yung mga parang nagka-counteract sa black magic. Now, um, during this time pa rin, prehistoric, early Christian era, there's a growth of religion. Most important thing that happened in this time is yun na nga, yung religion is talagang naging popular siya. It encourages a Christian value of love thy neighbor as thyself. So, yun na nga, just like in our commandment, di ba? So, you love your neighbor as yourself. And then, parable of the Good Samaritan that had influenced the development of Western nursing. So, growth of civilization, nagkaroon during this time, and then law of self-preservation, which inspire man in search of knowledge. After that, we have rise in civilization. So, ayan na, unti-unti na nagiging civilized yung mga tao. So, again, intuitive pa rin to. So, after prehistoric, rise in civilization na. So, from the mode of nomadic life, dati ay wala silang pirme sa tirahan, and then agrarian society, gradual development of urban community life. So nagkakaroon na ng development in terms of their living. So start of scientific knowledge, more complex life, and then increase in health problems demand for more nurses. So yun na, nagiging scientific na yung mga tao during this time kasi nga rise in civilization na. So nagiging complex na yung buhay. Dati simple lang, the survival of the fittest lang, 'di ba? Pero ngayon, it's getting complex and then mas nagiging scientific inclined na yung mga tao. So nursing as a duty of slaves and wives. So yung mga nagna-nurse, ayan, yung mga slaves ng and wives during this time. So nursing did not change but there was progress in the practice of medicine. So kung ano yung parang nursing before, 'di ba, subservient sila. In rising civilization, somehow ganun pa rin. Mababa pa rin yung tingin sa mga nagbibigay ng nursing or nagbibigay ng care sa mga may sakit. Pero sa practice of medicine, somehow nagkakaroon na ng progress. So care of the sick was still closely allied with superstitions and magic. So pag nagkasakit ka still, it's superstitions and magic pa rin yung inclination. So during this time, there's a birth of monotheism, that is believer of one God. So after that, Babylonians, under rise in civilization pa rin, for Babylonians, we have the Code of Hammurabi. Ito yung important contribution ng Babylonians. This is the first recording on the medical practice. So it established the medical fees, discouraged experimentation. So right of patient to choose treatment between the use of charms, medicine, or surgical procedure. So may mga options na available and may right si patient na mamili ng care na gusto niya for him or herself. So again, Code of Hammurabi, the first recording of medical practice, just like this one in the figure. Next, Egyptians, sila naman, one of the contributions is art of embalming, pag-embalsa mo. So, sa kanila, yung mummification, just like this, by removing the internal organs of the dead body through installation of herbs and salt to the dead. And then for Hebrew, they have Moses' teachings. So, si Moses, the father of sanitation, practiced the values of hospitality to strangers and the act of charity. So the laws controlling the spread of communicable diseases was like established during this time. Kasi nga, si Moses, siya yung para nag-spread ng sanitation across different places. And then in China, so they use pharmacologic drugs. And you have here Materia Medica. Ito yung material na meron sila during that time. Materia Medica, parang libro siya. So use of wax to preserve the body of the dead. So in India, they have Sushruto. So this is the first recording on the nursing practice naman. So that is in India. So there was proficient practice of medicine and surgery, but also decline in medical practice due to fall of Buddhism religion. Okay, so Sushruto, the first recording on the nursing practice. So that is in India. And then sa Greece, so you have Aesculapius. So he is known as the father or god of medicine in Greek mythology. So eto siya. Here, yung may hawak na parang um, and, ano ba tawag siya? Parang baston or um, a stick, so something like that. So you have Hippocrates, the father of modern medicine. So remember this, Hippocrates, the father of modern medicine. Caduceus, insignia of medicine. So ito yon, the insignia of medicine. So it composed of staff of travelers. So ito yung staff na yon, intertwined with two serpent. So nakikita nyo rito yung dalawang serpent na yan, which is the symbol of Aesculapius, the father of or the god of medicine in Greek mythology, and then his healing power. So yung pinaka-apex of the staff are two wings of Hermes for speed. Hermes or Mercury for speed. Ito yung may wings. Kita natin yung wings. So, this is caduceus kung tawagin or caduceus. So, that is the insignia of medicine, the symbol of medicine, caduceus or caduceus. Okay, so during this time, sa Greece, Greece pa rin, nurses, untrained slaves pa rin. So, still, same era pa rin naman, the rising civilization. Now, for Romans, you have Fabiola here, a matrons converted to Christianity and used her wealth, the forerunner of hospitals, for the sick and poor. So, yung wealth niya, convert niya, or ginamit niya para establish ng hospital. At para sa mga homeless. So, the first hospital in the Christian world. So, that is Fabiola sa Romans or in Rome. Or yeah, in Romance. So, next you have the 11th century to 1836, when the Deaconesses School of Nursing was established in Kaiserwerth, Germany, by Pastor Theodor Fliedner. So this is Pastor Theodor Fliedner. So an on-the-job training period. So by the way, this is now the apprentice period. Okay, so apprentice period ng nursing na so we are referring pa rin sa history of nursing. So apprentice period, apprentice, ito yung mga baguhan pa lang. So meaning parang possible pa lang yung nursing during this time. So apprentice period again 11th century, that is to 1836. 11th century to 1836. So ayun, we have Kaiserwerth, Germany, si Pastor Theodor Fliedner. And then yung OJT refers to a beginner work care performed by people who are directed by more experienced nurses. So during the crusade in this period, so maraming mga crusade during this time. So 11th century to 1836, it happened as an attempt to recapture the Holy Land from the Turk, who obtained and gained control of the region as a result of power struggle. So Christians were divided due to several religious war, and Christians were denied a visit to the Holy Sepulchre. Okay, so ito yung mga um, mga krusada. Okay, and then military religious orders and their works under apprentice period pa rin. So ano ba yung mga religious orders? You have Knights of St. John of Jerusalem, Italian siya, also called as Knights of the Hospitallers, established to give care. Okay, so na-establish yung knight na to to give care. Teutonic Knights took subsequent wars in the Holy Land, so cared for the injured and established hospitals in the military camps. So during this time kasi, di ba, maraming wars na nangyayari in terms of religion, kaya we have different crusades. So that's Teutonic Knights. Then Knights of St. Lazarus care for those who suffered leprosy, syphilis, and chronic diseases. Okay, so ito yung mga religious orders na parang, mga military religious orders na parang meron silang, parang meron silang goal or parang to serve. They have this intention or objectives na objective na makatulong. Alexian Brothers, a monastic order founded in 1348, they established the Alexian Brothers School of Nursing, the largest school under religious auspices exclusively in United States, and it closed down in 1969. Okay, so nursing saints during apprentice period pa rin. So you have Saint Clare of Assisi here. Ito siya. She took vows of poverty, obedience to service, and chastity. Founded the Second Order of Saint Francis of Assisi, the Poor Clare. So that is Saint Clare of Assisi. Okay, she is very dedicated. Next, you have Saint Elizabeth of Hungary. So the patroness of nursing, a princess, sees her calling to give care for the sick, fed thousands of hungry people. So Saint Elizabeth of Hungary. So ito siya. Again, remember, patroness of nursing. And then third one, we have Saint Catherine of Siena. Siya naman ay Little Saint, kung tawagin. She took care of the sick as early as 7 years old, so very young. And then she was known as the first lady with a lamp. Okay, so first lady with a lamp, Saint Catherine of Siena. So mamaya malalaman natin sila naman si Florence Nightingale. Okay, so those are the saints, okay? The nursing saints during apprentice period. So we have three. Next, 17th century naman to 19th century. Again, 17th century to 19th century. This is now the dark period of nursing. So dark period, malalaman natin why dark. So again, the range is 17th to 19th century. So this is also called as the period of Reformation until the American Civil War hospitals were closed. Nursing were the works of the least desirable people. So yung mga nagbibigay ng nursing or ng care ay mga criminals, prostitutes, drunkards, slaves, and opportunists. So napakapangit ng imahe, di ba? So nurses were uneducated, filthy, harsh, ill-fed, overworked. So nakikita nyo na yung reason kung bakit tinawag na dark period to. Kitang-kita nyo na really hindi maganda yung pagtingin or yung pagtrato sa mga sa nursing in general. So they worked 7 days a week, slept in cubby holes near hospital wards or patients. So ganito yung itsura ng nursing during this period. So the American Civil War was led by Martin Luther. The war was a religious upheaval that resulted in the destruction in the unity of Christians. So to continue, so nursing in America under the dark period pa rin. So meron namang somehow na iba. So we have the Nurses Society of Philadelphia organized a school of nursing under the direction of Dr. Joseph Warrington in 1839. So nurses were trained on the job and attended some preparatory courses. Again, so this is nurses in the United States. So Women's Hospital in Philadelphia, so established 6-month course in nursing. So ayan na, meron na tayong mga like courses na ino-offer for sa mga gusto mag-nurse or magbigay ng nursing or care to the sick. We have Dorothea Lind Dix established the Nurse Corps of the United States Army. She directed the nursing of the injured. And this one, itong nasa image, is Clara Barton. She founded the American Red Cross. Okay, so next, after that, now here comes the educative period. Okay? Okay, so again, dark period is 17th century to 19th century, and then educative period is begun June 15, 1860. Okay, so here comes another period. So we're done with the dark period. So let's discuss educative period. So it began on June 15, 1860 when the Florence Nightingale School of Nursing opened at St. Thomas Hospital in London, England. Her first program for formal education of nurses began and contributed growth of nursing in the United States. So please remember this. So we have now Florence Nightingale. Okay? She is known as a lady with the lamp. Okay? During that time, she was recognized as uh, now in our period. So Florence Nightingale is recognized as a mother of modern nursing. Again, Florence Nightingale, mother of modern nursing, and she was also known as the lady with the lamp. Okay, so lady with the lamp. So if you would remember kanina sa discussion natin about saints, 'di ba? Meron tayong isang saint na associated with the lamp, 'di ba? And that is Saint Catherine of Siena. Now, in this case, si Florence Nightingale, she is also she was also known as the lady with the lamp during her time. Kasi ayan, tuwing gabi nakikita siya na naglalakad, sa hall, parang nagra-rounds siya sa mga pasyente, okey, sa mga taong may sakit. Kaya siya tinawag na Lady with the Lamp. Siya tuwing gabi ay umiikot sa mga pasyente niya to check on them. So again, also known as a mother of modern nursing. So that is Florence Nightingale. So she was born on May 12, 1820 in Florence, Italy. Raised in England in an atmosphere of culture and affluence. She developed her self-appointed goal, and that is to change the profile of nursing. So advocated for care of those afflicted with diseases caused by hygienic practices. So at the age of 31, she entered the Deaconess of School at Kaiserwerth and led the nurses, took care the wounded during the Crimean War. So napakalaki ng kanyang contribution during the Crimean War. She reduced the casualties of war by 42% to 2%. So napababa niya yung mga namamatay during a war, yung mga soldiers during that time in the hospital, napababa niya yung rate, yung casualty from 42 to 2% na lang. Okay, by improving the sanitation techniques in the military barracks. So, ang kanyang inayos is yung environment of the hospital or of the barracks. Okay, in that case. Okay, military barracks, inayos niya yung surrounding, inayos niya yung environment, yung sanitation para ma-improve yung care ng mga pasyente. So other important persons, groups during this period, educative pa rin. So Linda Richards, the first graduate nurse in United States, graduated in September 1, 1873. Dr. William Halsted designed the first rubber gloves. Caroline Hampton Robb, the first nurse to wear the rubber gloves, working as an operating nurse. So merong gumawa, tapos merong unang nagsuot. American Nurses Association and National League for Nursing Education, a nursing organization that contributes to the uplift of nursing profession. So we now have, in America to, no, they have, kung tayo may PNA, sila may ANA, American Nurses Association, and NLN, the National League for Nursing Education, NLNE. Okay? So, yan, nag-uplift ng nursing profession in the United States. So, after educative period, we now proceed to contemporary period. So, ito na yung ating pinaka-latest period, yung pinaka-present, the contemporary period. So, the period after World War II to the present. So, we have here WHO, or the World Health Organization, was established by the United Nations to assist in fighting disease by providing health promotion and improving nutrition, living standards, and environmental conditions of all people. So, during this period, there's a use of sophisticated equipment for diagnosis. So, di ba, yung mga equipments na ginagamit naman talaga natin, really very advanced, very in terms of technology, in terms of yung pagka-scientific niya, di ba, talagang napakalaking tulong in terms of the health, or in terms of providing health to the sick, or in terms of health promotion din. Utilization of computers for collecting data, definitely very evident yan sa atin. Colonel Pearl Tucker developed a comprehensive parang a 1-year course to prepare nurses for aero. Again, putol eh. Colonel Pearl Tucker developed a comprehensive 1-year course to prepare nurses for aero. Okay, that is an aero course. So nursing is offered in colleges and universities. Siyempre, yun naman na talaga yung practice natin ngayon, di ba? So you take nursing as a course sa university, okay, sa isang kolehiyo. Now, what are the different factors affecting nursing today? Ano-ano ba yung mga factors na nakaka-apekto sa nursing? So first, I'll just say it here. So I'll just leave the rest of the reading sa inyo. First, the healthcare reforms. Next, consumers demand, family structure, information and telecommunications, and legislation. So these are the factors that affects nursing today. At napakalaki ng impact ng mga factors na yan sa ating profession, sa ating ginagawa as a nurse. So after knowing the history of nursing, in general or sa pangbuong mundo, we now proceed sa history of nursing in the Philippines. So in our context, paano ba na-develop yung nursing? So we have the early beliefs and practices. So the beliefs about causation of diseases. So ang paniniwala nila dati na it is caused or inflicted by person. So nagkakaroon ka ng disease or sakit dahil sa may dahil sa ibang tao. For example, ikaw ay may nakaaway or ikaw ay napagdiskarte napag I mean nakonsunadahan ng witch. Okay? So, or yung witch yung may gawa ng iyong pagkakasakit. And then they believe about evil spirits. So beliefs that evil spirit could be driven off. So paano natatanggal yung mga evil spirits? Natatanggal yan ng mga person with powers to expel bad spirits. Tapos belief in gods of healing. So naniniwala sila sa mga gods ng paggamot. And then herbolarios, they are known as herb doctors. So, paano yung early care of the sick? Paano ginagamot yung mga may sakit in the earlier days dito sa Pilipinas? We have herbicheros. So, these are herbmen who practice witchcraft. Again, herbmen who practice witchcraft. Ito yung mga gumagamit ng halaman. Okay? Na ginagamit to through witchcraft. And then mangkukulam, one who practices witchcraft naman. And then difficult birth, witches were supposed to be the cause. Gunpowder exploded from a bamboo pole close to the head of the mother to drive evil spirits. So yan yung unang paniniwala. Paniniwala siya before about sa difficult birth. Kapag hirap ka manganak, so ito yung paniniwala nila during that time. Now, early hospitals in the Philippines. So, pinakita lang dito, we have Hospital Real de Manila in 1577. So, this is the first hospital established. Hospital Real de Manila. So, ang governor is Francisco de Sande during that time ginawa siya to give service to the king's Spaniards soldiers. So, para sa mga ibang lahi pa yung unang ospital. Okay, para sa mga soldiers. And then San Lazaro Hospital, 1578, that is established by Fray Juan Clemente, named after the Knights of St. Lazarus, and it is the hospital for the lepers. And then Hospital de Indios, established 1586 by Franciscan orders, and this is the hospital for the poor Filipino people. Hospital de Indios. Okay, next we have early hospitals pa rin, Hospital de Aguas Santas in 1590 by Fray Juan Bautista, named after its location near spring because people believe that spring has a healing power. And then this one is the San Juan de Dios Hospital, 1596. This is for poor people pa rin, located at Rojas Boulevard. So, San Juan de Dios Hospital yun. Next, nursing during the Philippine Revolution. So ano naman yung nursing during the Philippine Revolution? Ito yung mga giyera naman dito sa sa ating bansa. Okay, so we have Doña Hilaria de Aguinaldo. So ito siya, the first wife of Emilio Aguinaldo. She established Philippine Red Cross, PRC, February 17, 1899. Doña Maria Agoncillo de Aguinaldo, the second wife of Emilio Aguinaldo. She was the first president of Philippine Red Cross, the Batangas chapter. And then we have Josephine Bracken, helped Rizal in treating sick people. And then Melchor Aquino took care of the wounded Katipuneros. So parang sila yung mga pioneering care sa Pilipinas during that time. So next we have Anastasia Giron Tupas. So the founder of Filipino Nurses Association, established on October 15, 1922. She was also the first Filipino chief nurse of Philippine General Hospital or PGH. So remember her, Anastasia Giron Tupas. Also the first Filipino superintendent of nurses in the Philippines. So Anastasia Giron Tupas. Next, Francisco Delgado, first president of Filipino Nurses Association. Loreto Tupas, the Florence Nightingale of Iloilo. Again, Loreto Tupas, Florence Nightingale of Iloilo. So parang kinukumpara or inahawig siya kay Florence Nightingale. Cesaria Tan, first Filipino to receive masteral degree in nursing abroad sa ibang bansa. Yung kanyang master's degree. Now, nursing during the Philippine Revolution, just the continuation, ito pa yung mga tao na nag-initiate ng nursing or nag-contribute sa nursing here in the Philippines. Socorro Cirilan, pioneer in social service at San Lazaro Hospital. Also, she was the chief nurse during that time. Rosa Militar, pioneer in nursing education. Socorro Diaz, first editor of PNA magazine called The Message. PNA, ito na yung Philippine Nurses Association natin, our mother organization. Conchita Ruiz, full-time editor of a PNA newly named magazine, The Filipino Nurse. So early nursing schools naman, mga unang eskwelahan or universities or offering nursing schools sa atin. You have Iloilo Mission Hospital and School of Nursing, established in 1906 under the supervision of Rose Nicolette. She was an American. Nursing course, 3 years pa lang during this time. Produced first batch of nursing graduates in 1909 and there are 22 nurses, yung first batch of nursing graduates. So the first trained nurses here in the Philippines are Nicasha Cada, Felipa de la Peña, and Dorotea Caldito. In April 1944, so ang tagal bago magkaroon ng board, ano, merong nursing graduates in 1909, and then the first nursing board exam is at Iloilo Mission Hospital, and that was April 1944. So ang tagal na ng ano, 'di ba, ng practice of the board exam among nurses. Okay, to continue, we have ito pa yung mga early nursing schools and when was it established? PGH School of Nursing 1907, St. Paul School of Nursing 1907, St. Luke's School of Nursing the same, USC is 1946, and Fatima 1947. Okay, so we are done with the first major, with the first subtopic, nursing as a profession. Now we proceed to the second part of our topic, nursing as an art. So let us get to know kung kanina nursing as a profession, nakita natin paano na-develop yung nursing bilang profesyon. Okay, natin, paano natin nakikita yung nursing ngayon as a profession, yun ay nag-root sa ating history. And now, ang pag-uusapan naman natin ngayon dito is nursing as an art. Ano ba siya bilang art? Okay? So, as an art, nursing, we can consider it as caring. So, nursing as an art, and that is caring. So, caring, and by definition, it is sharing deep and genuine concern about the welfare of another person. Pag sinabing caring for self, it means taking the time to nurture oneself. So this involves initiating and maintaining behaviors that promote healthy living and well-being. Okay? So caring, ito yung aaruga or yung concern natin, authentic concern natin or genuine care natin sa ibang tao. Now, we have here different concepts from different theories or different nursing leaders na meron tayo. So again, we have Patricia Benner. Ito yung kanina, di ba, from the stages of nursing, from novice to expert, di ba? So here another concept, yung i-introduce natin, si Patricia Benner, Caring Clinical Wisdom and Ethics in Nursing. So caring is essential to the essence of nursing, according to her. And then caring creates possibility for coping, stressful conditions, for connecting with and concern for others. So caring enables nurses to help clients recover in the face of illness, to give meaning to that illness, and to maintain or reestablish connection. So as a nurse, 'di ba, we provide care to our patient. We care for them. Okay? So kaya naman sinabi ni Dr. Patricia Benner, caring is central to the essence of nursing. So parang it's like the core, okay, sa pagpo-provide ng ating care. I mean sa pagpo-provide ng nursing to our patient. Okay? So that is care or caring. So Jane Watson naman, theory of human caring. So in her concept, she emphasized that nursing is the application of the art and human science through transpersonal caring transactions to help person, mind, body, soul harmony. So which generates self-knowledge, self-control, self-care, and self-healing. So according to her, according to Jane Watson, in nursing daw is application of both art and human science. So that is her main concept or her main the keywords that we should remember for Jean Watson. So next, professionalization of caring. So pag sinabing caring practice, it involves connection, mutual recognition, and involvement between nurse and client. According to Milton Mayeroff, in 1990, defines major ingredients of caring as follows. So ito yung mga major ingredients daw sa pag-aalaga. So again, professionalization of caring. Ito yung mga major ingredients sa pag-aalaga, sa caring practice natin. So we have knowing, alternating rhythms, patience, honesty, trust, humility, hope, and courage. So please take note of all these ingredients and please read na lang thoroughly upon getting the PowerPoint. So yun yung mga ingredients for caring practice. Next, we have here theory, caring. Another theory ito na. So the title is Caring, the Human Mode of Being. That is from Roach. So she believed that individuals are caring and develop their caring abilities by being true to self, being real, and being who truly they are. So according to her, there are 6 C's of caring. So ito yung 6 C's of caring ni Roach. Or you have compassion, competence, confidence, conscience, commitment, and comportment. So kindly read na lang again. And then you have caring for self. This is from Mayeroff. So Milton Mayeroff pa rin, 1990. He describes caring as helping oneself grow and actualize one's possibilities. Self-care means taking the time to nurture oneself. It is the opposite of self-complacency that often accompanies egocentricity. So, pag sinabing caring for self, hindi tayo like focus sa ating sarili lang, like we are being selfish, but we are we are seeking to nurture ourselves. Okay? Hindi naman necessarily na pag sinabing self-care or caring for self, ikaw ay selfish na agad. Okay? You are just looking for yourself. Okay? So example ng healthy lifestyle, it includes nutrition, activity and exercise, and recreation. So self-care, when defined as responding to one's own needs to grow, is the opposite of the self-complacency that often accompanies egocentricity. So ito na nga yung definition kanina, so naulit lang siya. So caring for self means taking the time to nurture oneself. So caring as helping the other grow. So Milton Mayeroff is a noted philosopher, has proposed that to care for another person is to help him grow and actualize himself. So Now, how do we take care of ourselves? So ito yung caring for self, ano. So, ito yung mga aspects na ginagawa natin to take care of ourselves. So, we have healthy lifestyle. So, ano-ano yung components ng healthy lifestyle? So, you have nutrition. So, when you say nutrition, this is about healthy eating. Yung pagkain natin ng masusustansyang foods. Okay, please read thoroughly. Next, activity and exercise. Ito naman yung essential for energetic, active, and healthy living. Okay, and then we have recreation. So this is taking time to do the things that bring joy and stimulate creativity. So dapat we have time for recreation para sa ating sarili. Avoiding unhealthy patterns. So this means avoiding activities or thought patterns that contribute to negative health outcomes. Ano-ano yung mga positive affirmations para maka-avoid tayo sa mga unhealthy patterns. So begin the day with positive statement by saying to yourself na I am person of worth and goodness. I am happy to be alive. I am in the right place at the right time. I am prepared to do a good job today. I am surrounded by people that I love who love me. I am doing what brings me joy and this is an opportunity to grow. So these are positive affirmations para maiwasan natin yung pagiging nega. So what else? Mind body therapies. This is the interconnectedness of the mind and body. So, mga example nun, it includes music therapy, meditation, imagery, storytelling, and yoga. So, after caring, di ba, we said na nursing as an art, the first one is caring. The other one, nursing as an art, communicating naman. So, alam na natin na nursing is an art, number one, by caring. So, we take care of our patients. Another one, nursing as an art through communication or by communicating to other people and to our patient. So when we say communication, so it is a dynamic process used to gather assessment data to teach and persuade and to express caring and comfort. So it is an integral part of the helping relationship. So definitely napakahalaga ng pakikipag-usap natin sa ibang tao. Okay? So exchanging information to our feelings between two or more people. It is a basic component of human relationships, including nursing. So, basic sa atin to. Okay, yung communication. Now, we have here the communication process. And in the communication process, we have the sender. And then for the sender, you encode first and then you give message to your receiver. Si receiver naman, magde-decode siya and then mag-encode after ng kanyang response. And then pero pag meron na makakaisip na siya ng response or message, i-decode naman siya ni sender. Okay? So ito yung communication process. So, yun na lang guys, ano, please read the next slides. Pero ang gist nito is that ito yung paano nagwo-work yung communication process. So definitely si sender, yung taong makikipag-communicate, he will first think of something na gusto niyang sabihin, gusto niyang i-communicate. So mag-encode muna siya ng information. Once na-encode niya na or na-gather niya na yung gusto niyang yung thoughts na gusto niyang sabihin, i-relay niya na yung message sa taong kakausapin niya, which is the receiver. And then si receiver, upon getting the data or the information na sinabi ni sender, i-decode niya muna yon. Ipaprocess niya muna yung data or yung information na nakuha niya. And upon decoding, definitely, iisip ngayon siya ng kanya magiging response. Kung ano yung magiging sagot niya or kung ano yung masasabi niya sa sinabi ng sender. So, mag-encode siya ng sarili niyang response na kanyang sasabihin. And then, pag nakapag-encode na siya, definitely, i-communicate or sasabihin niya to through feedback sa kanyang sender. Okay? Sa kanyang kausap. And then, yung sender na to or yung kinakausap niya, i-decode niya naman uli, i-decode niya naman ngayon yung sinabi ni receiver until ma-process niya yung information. And the process continues hanggang sa matapos yung communication process. Okay, so that's the summary of the communication process na nandito sa aking PowerPoint slide. So I will leave the thorough reading, the comprehensive sa inyo guys. So please read this communication process. Okay, so you have the sender, you have the message, and then you have the receiver and the response. Ito yung sinabi or diniscuss ko kanina. Now, for modes of communication, we have verbal communication. It uses the spoken or written words, and it's largely conscious because people choose the words they use. So, ito yung mga sinasabi natin, ito yung mga sinusulat natin. So, non-verbal communication, ito naman yung mga forms such as gestures, facial expressions, and touch. Sometimes called body language. So, ito yung mga hindi naman natin sinasabi without any verbal implication. Pero definitely, ito yung mga pinapakita natin. Okay? Through body movements, touch, facial expression, etc. And then electronic communication, we use here email. Okay? Para makapag-send ng information, definitely using computer. So, now, what are the factors influencing the communication process? So, ito yung mga factors that influences yung communication. So, dapat alam natin yung mga pwede makapag-promote or makapag-hinder ng communication. So, you have development, gender, values, and perceptions, and then boundaries. Now, for boundaries, we have here personal space. Okay, so personal space. Okay, so pag sinabi kasi boundaries, this is limits of individuals, objects, or relationships. Okay? Now, for personal space, ito naman yung distance. Is a distance people prefer in interactions with others. Ito yung layo ng pakikipag-usap natin sa ibang tao. So, we have your intimate, personal, social, and public. So for intimate, ang range ng distance niyan is from 0 to 1.5 feet. Okay, so intimate distance yan. So personal distance, you have 1.5 feet to 4 feet. Again, personal distance, you have, personal space, that is 1.5 feet to 4 feet. And then personal distance, that is for personal, ano. Next, social distance naman, 4 feet to 12 feet. So, medyo malayo na. And then, for public, ito, 12 feet and beyond. So, that is far. So, pakibasa na lang again thoroughly yung descriptions for each distance or personal space. Okay, next, territoriality. This is, again, going back to the factors that affects the communication process. Territoriality, roles and relationships, environment, congruence, interpersonal attitudes. So for the interpersonal attitudes, meaning yung ugali mo sa pakikipagkapwa mo, it includes caring and warmth, respect, and acceptance. So those are the factors that influence the communication process. And again, I will leave the comprehensive reading to you guys. I will send to you the PowerPoint so that you can review. Okay, so therapeutic communication. So ito yung sinabi ko kanina about dun sa discuss natin deeper. So therapeutic communication, it promotes an understanding and can help establish a constructive relationship between the nurse and the client. So, ano yung kaibahan niya sa social relationship? Um, unlike social relationship where they may not be a specific purpose or direction, so kasi pag social communication or relationship, parang we are not that specific. Sometimes, um, not purposeful and walang specific direction. Now, when we say therapeutic communication, this is the therapeutic helping relationship. and client and goal-oriented. Again, kapag therapeutic communication, yung pinag-uusapan, again, therapeutic communication, this is goal-directed, tayo ay goal-directed, and therapeutic helping relationship with our client. Okay, so ito yung pagtulong natin sa ating pasyente. And ito ay goal-oriented, meaning meron tayo kasing objective na gusto makamtan um, in taking care of our patient. Okay? At yun yung mapagaling natin siya. Now, for therapeutic communication, we have different techniques sa pakikipag-usap sa ating patients, sa ating clients. Okay? And for it to become successful, para tayo ay makapag-establish ng good therapeutic relationship, definitely dapat yung communication natin sa ating pasyente ay maayos. And that is, dapat alam natin yung different techniques of therapeutic communication. Okay? Again, therapeutic communication, we are client-oriented and we are goal-directed. We are, meaning we are focused to our patient, we are considering our patient, and we have a goal to accomplish. So here are the different techniques. So first you have silence, using silence. So ito yung kanyang description. So we use pauses or silences that may extend for several seconds or minutes without interjecting any verbal response. For example, you will just sit quietly and wait attentively until the client is able to put thoughts and feelings into words. So nananahimik muna tayo para malaman kung ano yung gustong sabihin ni pasyente. Okay? Para makapag-open up sa atin, para marinig natin yung mga gustong sabihin ni patient sa atin. So again, therapeutic communication techniques na to yung ating pakikipag-usap sa ating pasyente. Providing general leads. So we use statements or questions that encourage the client to verbalize. And then choose a topic of conversation and facilitate continued verbalization. So ito yung mga examples ng providing leads. So ibig sabihin, nililid natin si pasyente sa sa communication. For example, can you tell me how is it for you? So gusto nating masabi niya kung ano pa yung kung how is it for him or for her. Okay? So perhaps another example, perhaps you would like to talk about it. And then what? Tapos ano pa? Okay, tapos po, so that is like an example of providing general leads. Now, being specific and attentive, so making statements that are specific rather than general. So we are specific with our communication. For example, rate your pain on a scale of 0 to 10. So specific yung yung number na gusto natin, di ba? 0 to 10, that's the range mamimili si patient. Are you in pain? So that is general. Ang dapat, rate your pain on a scale of 0 to 10. So that is more specific. So ito, open-ended questions. How do we use open-ended questions? Ito yung paggamit natin ng broad questions para ma-explore natin yung feelings, yung thoughts ni pasyente. For example, tell me more. Sige po, magkwento pa po kayo. So I'd like to hear more about that. Kamusta po kayo ng mga nakaraang araw? So it encourages the patient to open up. So that is an open-ended questions. So using touching, it provides appropriate forms of touch providing appropriate forms of touch to reinforce caring feelings. So ito yung mga putting an arm over the client's shoulder, placing your hand over the client's hand, or yung pagtatap lang natin sa shoulder sa ating pasyente. So, ginagamit natin siya definitely to show that we care to our patient. Again, without any malice, this is a therapeutic communication technique. So, because tactile contacts vary considerably among individuals, families, and cultures, you must be sensitive as a nurse to the differences in attitudes and practices of clients and self. Restating or rephrasing, I know that this therapeutic communication is somehow na-discuss na in your health assessment, sa how to conduct an interview. Okay? Kasi how to get health history from our patient. So definitely, during that time, habang tayo ay nag-gather ng subjective data, we are also using therapeutic communication to our patient. We are building good therapeutic relationship to our patient during that time. So somehow may idea na kayo dito about therapeutic communication techniques. So I will again read the rest of the readings sa inyo. Please make sure that you read all the other techniques such as seeking clarification, perception checking, offering self. Ito, very common to offering self. For example, I'll stay with you until your daughter arrives. So I will help you to dress to go home if you like. So that is offering self. So nag-offer tayo ng help sa ating pasyente. Giving information and then acknowledging. So others are clarifying time or sequence, presenting reality, focusing, reflecting, summarizing, and planning. Now, if we have therapeutic communication techniques, meron tayo ring na barriers to communication. So ano ba yung mga barriers or hadlang or mga hindrances in our communication to patient? Meaning, hindi tayo makaka-build ng good therapeutic communication or good therapeutic relationship sa pasyente kapag may mga barriers. And this includes stereotyping. Pag sinabing stereotyping, we offer generalized and oversimplified beliefs about groups of people that are based on experiences too limited to be valid. Okay, tayo ay kumbaga, nag-stereotype tayo. Example, 2-year-olds are brats. Okay? Parang generalize na natin. Men don't cry. So the stereotyping, we are like generalizing. Women are complainers. So that is a barrier to communication. Agreeing and disagreeing, dapat we prevent or inhibit ourselves from agreeing and disagreeing to our patient. For example, the client said na, I don't think Dr. Broad is a very good doctor. He doesn't seem interested in his clients. Tapos, ang sinabi mo, Dr. Broad is head of the Department of Surgery and is an excellent surgeon. So, parang you are disagreeing to the um, statement of the patient. So, you should avoid that. Being defensive. So, again, I will read the rest of the barriers of communication to you. Kindly read thoroughly na lang. So, avoid being defensive, avoid challenging the patient, and avoid um, probing. So, pag sinabing probing, asking for information chiefly out of curiosity rather than with the intent to assist the client. So, parang chumichismis na lang tayo. So, we should avoid that. We avoid testing. We do not reject ideas or feelings, changing topics and subjects, unwarranted reassurance, passing judgment, giving common advice. So, we do not want that. So again, can you read na lang the rest of the barriers of communication. Now, for the phases of the helping relationship, we have different phases. So first, you have, ang ipapakita ko na lang dito guys is itong pinaka-table or summary of the phases of helping relationship. So we have here, so again, the phases are the phase of the helping relationship. So pre-interaction phase, the nurse reviews pertinent assessment data and knowledge. So ito yung bago pa tayo makipag-interaction sa ating pasyente. So this is before the interaction. Okay, so tayo nagpe-prepare pa lang. And then next phase is the introductory phase, and under this we have three major points. First, you have opening the relationship, and then clarifying the problem, and then third, structuring and formulating the contract. Again, please read thoroughly. So, pre-interaction phase, introductory phase, and then you have the working phase. So, for the working phase, ito na tayo talaga nagtatrabaho and then working to solve or address client's problem. So under working phase, you have exploring and understanding thoughts and feelings, and then facilitating and taking action. And the last phase is the termination phase, definitely, where the nurse and client accept feelings of loss. So for the nurse, summarizing skills for, and then for the client, ability to handle problems independently. So we summarize yung napag-usapan din sa termination phase. And ayun, so the client accepts the end of the relationship without feelings of anxiety or dependence. So, yon. Now, dito pinakita lang yung communication and the nursing process. So, paano ba ina-apply yung nursing process sa communication? So, definitely, again, our nursing process includes assessment, diagnosis, planning, intervention, and evaluation. So, dito, sa pakikipag-communicate or pakikipag-usap kay patient, di ba, we continuously assess from our initial encounter up to the end. So, sa pakikipag-usap pa lang, our initial encounter, we assess na our patient. For example, when we are talking, we assess for the impairments to communication. And that is language deficit. Baka may problema siya with his or her language. Or baka hirap siya makipag-communicate because of, for example, iba pala yung language na ginagamit niya. And then sensory deficits, the ability to hear, see, feel, and smell are important adjuncts to communication. So, if meron siyang problem, for example, deafness, it can significantly alter the message the client receives. So, dapat we have to be aware of this. We have to assess our patient for any impairments to communicate. Others, you have cognitive impairments such as Alzheimer's disease, CVA, brain tumors, or injuries. Structural deficits, ito naman yung oral and yung structural deficit definitely refers to structures such as oral and nasal cavities and respiratory system that can alter a person's ability to speak. Ito yung example, cleft palate, artificial airways such as endotracheal tube or tracheostomy, and laryngectomy. And then paralysis. So definitely, kung paralyzed the patient, that is an impairment to communication. Mahirapan siya makapag-communicate sa atin, makapagsalita. So for the diagnosing, planning, and implementing, so please read the rest of the nursing process in line with communication. So very ano na lang siya, self-taught na lang siya. And then, so yun, we have nursing as caring. And then we, after that, we proceed now sa nursing as an art. Okay? So we are done with nursing as caring, and then I mean nursing as an art, which is caring, and then nursing as an art, which is communication. This one, nursing as an art, teaching naman. So ito, for this one, so when we say teaching, so teaching is a system of activities intended to produce learning. So the teaching process is intentionally designed to produce specific learning. So you have here health promotion. So we teach our clients to promote one's health. And how do we do that? So we teach the client different aspects such as increasing a person's level of wellness, growth and development topics, fertility control, hygiene, nutrition, exercise, stress management, lifestyle modification. So ito yung mga tinuturo natin in terms of health promotion. So ito yung mga aspects na pwede nating ituro sa ating pasyente. And then resources within the community. For disease prevention, so definitely we have health screening here. Example, blood glucose levels, blood pressure, blood cholesterol pap test, okay, vision, hearing, routine physical exam. So, reducing health risk factors. So, yun, under disease prevention pa rin. Restoration of health or maintenance. This is information about tests, diagnosis, treatment, medications. And then rehabilitation, this is adapting to altered health and function. So adaptation in lifestyle, problem solving skills. So we ibig sabihin guys na nursing as an art, which is teaching. So we teach our patient from the different levels, from different aspects. Yung sa scope of nursing natin, di ba? If you could remember the scope of nursing, di ba, you have health promotion. So definitely, we teach our patient in terms of their health promotion. And then another scope of nursing is disease prevention. So definitely we discuss to our patient, we teach them, we educate them how to prevent diseases or how to prevent a disease. And then another scope is restoration of health and maintenance, wherein we teach or educate them kung paano sila makaka-restore ng kanilang good health and how to maintain yung well-being nila. And then yung another scope is rehabilitation. And this is how they adapt to changing health status. Okay, yung adaptation nila sa nangyari sa kanilang katawan. So we educate and we teach our patient. Okay, so that comprises my topic. So for nursing as an art, we discussed yun nga, nursing as an art, which includes teaching, and then you have communicating, and then you have um, caring. So you have three. Again, nursing as an art, we discuss caring, um, communicating, and teaching. So that is under nursing as an art. And then sa nursing as a profession, we discuss kung paano na-develop in nursing um, by going through the history up to the contemporary period, among other topics pa under the nursing as a profession. So that comprises chapter 2, and that is the concepts of nursing. So I hope na you have learned something from this discussion. God bless and have a great day.